Heat and cold in medicine. Therapy and diagnoses. By Assistant Professor of Medical Physics, Dr. Al-Arif. Thermal power radiated. Every living object emits electromagnetic radiation power in the form of infrared light with a power given by Stefan's law as the power, P, equal to the emissivity, E, multiplied by Stefan constant, sigma, by the area, in centimeter square by the temperature, T, to the power of 4. Emissivity for tissue is 1. Stefan constant equal to 5.7 times 10 to the power of minus 12 in unit of watt per centimeter square per Kelvin to the power of 4. Solved X. Please follow the solution carefully. Thermography, mapping of body temperature. It was found that the most breast cancers in one side of the body has a temperature of 1 degree Celsius higher than that of normal breast on the other side, healthy. The cancer often tend to increase the blood flow around it for more nutrition and oxygen. It was thought that this will be good procedure for early breast cancer detection and is called thermogram. The surface of the body temperature is slightly different in different parts of the body depending on external physical factors and internal metabolic and blood supply to the skin. All objects regardless on their temp, emit heat radiation in the invisible infrared radiation, IR, of long wavelength. Thermography is a radiation-free procedure that uses an infrared camera to measure the temperature difference of each breast or body parts to aid in the early detection of cancer. As a cancer grows, more blood vessel will develop and become hotter. By using this principle, a thermograph instrument was designed to measure the radiation emitted from that part of the body. See the figure. Thermography usually takes place in cold room to increase the temp difference between region of poor and normal blood supply, consequently the contrast improved. The machine can detect 0.2 centigrade temperature difference. The procedure takes about 20 minutes at room temp. 20 to 21 centigrade. In this image the heat surrounding the nipple in the right side is in excess of normal levels and may indicate abnormal increase of blood vessels growth that may be used to feed a cancer. The delicate balance of progesterone to estrogen hormones is an important function of the female body. The expression of estrogen can be seen on thermal images. Increasing estrogen is a condition that has been associated with breast cancer. The right side image below shows a hot flash of estrogen hormone distribution. Heat therapy. Heat was recognized as therapeutic agent several thousand years ago. It has the following therapeutic effects: an increase in metabolism resulting in relaxation of the blood capillaries and muscles. An increase in blood supply result in cooling down the hot area of the body. Increasing blood flow carries more white blood cells to the infected area of the body and increase the therapeutic effect. Heat can be transferred to the body by several ways, such as by conduction, radiation, IR, ultrasound and electric heating electrodes, diathermy, or by induction coil. Figures showing different uses of heat therapy. Low-temperature region therapy, cryosurgery. Low-temperature science referred to the cryogenic region, absolute zero, minus 273.15 centigrade. The cryogenic methods are used to destroy cells called cryosurgery, which has several advantages: cause a little bleeding. The volume of the tissue destroyed can be controlled. Little pain because low temp. Desensitize the nerves. Very short recovery time. One of the first uses of cryosurgery is in the treatment of Parkinson's disease, shaking palsy. Parkinson's disease causes uncontrolled tremors in the arms and legs. It is possible to stop it by destroying parts of the thalamus of the brain that controls nerve impulse to the other part of the nerve system. As in the figure, the treatment undergoes while the patient unconscious. The probe at minus 10 centigrade moved into the appropriate parts of the thalamus, causing temporary freezing. The frozen area can recover if the probe tip is removed in less than 30 seconds, while the surgeon is moving the probe, and when the tremor stops he will keep the probe a few minutes at that temp. Cryosurgery is also used in eye retinal detachment. A cool tip is applied to the outside of the eyeball. In the vicinity of the detachment a reaction occurs that acts in weld the retina to the wall of the eyeball. The thalamus is a vital structure lying deep within the brain that has several important functions. There are extensive nerve networks that send signals all around the structures of the brain, including the cerebral cortex. The thalamus is involved in sensory and motor signal relay and the regulation of consciousness and sleep.